and welcome to Viewpoint on Ukraine today, where we are joined by John Holuk, a coordinator for Ukraine Appeal, an initiative of the Ukrainian-Canadian Congress. John, thank you very much for joining us.
My pleasure. Thank you for having me.
So you have recently arrived in Ukraine with a team from Canada. I understand this is your first time in the country. You're normally based in Toronto. Can you tell us what brought you here?
Well, several things. I've joined the Canadian surgical mission here. But I'm here really to meet with embassy officials, some of our partners, on behalf of the Ukraine Appeal, as we try and coordinate and implement many projects in support of Ukraine.
OK. Can you tell us about these projects? Absolutely.
One of the ones that we're currently working on is an initiative to bring ambulances to Ukraine. Okay. We hope to deploy those ambulances where the need is greatest, and then support that with training and exchange of knowledge and best practices with paramedics from Canada.
OK, so where are these ambulances coming from? They're being sent over from Canada?
They're coming from Canada, and it's truly a national initiative where many provinces in Canada have donated the ambulances. We have received ambulances from Saskatchewan, Manitoba, Ontario, and by the time we're finished, we hope to receive 16 ambulances from across the country.
OK, and these provinces, are in Canada, do they have a large Ukrainian diaspora?
They do. There are 1.2 million people in Canada of Ukrainian descent. In the western provinces, there's quite a high proportion. Saskatchewan, for example, 25% of the population in that province have Ukrainian heritage.
OK. So you hope to bring over 16 ambulances from Canada?
Yes.
Have any already arrived?
The 16 will be the second phase. We had our first phase of the project completed in September of last year. We sent over 4 ambulances, and they were deployed to military hospitals in Dnipropetrovsk, Kharkiv, and Vinnytsia.
So towards the east of the country, closer to the conflict zone?
That's where we saw the need as the greatest. The war was quite intense then, and these ambulances are really designed for transportation and care of injured.
OK. Yeah. So the first 4 ambulances went over to military hospitals. Yeah. The next phase, which will be the additional 16 ambulances, will they also be going to military hospitals, or do you see those being used in a different way?
I think what we're doing here is trying to evaluate the need, and we've met with a number of people, and we expect that the ambulances will be distributed amongst several different organizations, including the civilian emergency services, which in particular in the East were devastated by the conflict. We're also working with some partners to perhaps implement mobile clinics where medical care in remote communities has also suffered greatly. So we're working to identify those needs, but we believe that the ambulances will be distributed amongst a broader range of recipients.
OK, so in the process of identifying needs, do you see a lot of them going to areas of the country which have been affected by conflict, or do you also see the organisation helping in cities which have not really been affected by the conflict so much, helping with the emergency services in Kiev, for example, or Lviv or Odessa?
We actually have a meeting with hospitals in Lviv. They would like to pilot a program, but we believe the majority of the ambulances will be further east, but there will be a balance across the country where there's a need.
OK. So, John, can you tell us a bit about these ambulances? I assume it's not just a vehicle, it's coming with some kind of equipment.
We have a range of partners from the paramedic and medical community. The ambulances are somewhat unique in terms of ambulances you would typically see here. They're rather large. They have the capacity of carrying 2 patients at a time. They're very convenient for the medical staff to work in, and our partners have helped us equip them extremely well, from trauma bags, supplies, equipment, to defibrillators and things of more of an advanced nature.
OK, so when the first 4 ambulances came over, did your Ukrainian counterparts, did they understand how to use them and the various technology that was on board?
They did. It took a little time because the configuration was new, but we are also, from that part of our program, where we took away the need to ensure that we bring individuals over to provide some training when the ambulances arrive. So we'll have experts that will share how to operate the ambulances, the equipment involved, and then hopefully extend that training to the paramedic type education and sharing of practices that we spoke of earlier.
OK, so this is the next stage then. You're bringing over the ambulances, and the next stage is then to work with the paramedics and the emergency services.
Correct.
OK. Can you tell us your plans for this?
Well, I think what we try to do is understand the needs here in Ukraine. The services are structured differently than they are in Canada. So the plans at this stage, and part of the reason I'm here, is to work with the various services to understand what their current needs are, whether they be in terms of equipment or knowledge or training. And then we'll take that back home to Canada and then try to design a program that would meet their needs.
OK. Yeah. So if we can talk about funding for a moment, where is the funding for this project, for the ambulances and for the training coming from?
The ambulance funding comes from a number of sources. Really leading our effort was the Ukrainian-Canadian community in Canada. We have supplemented that with funding from some of the provincial governments, and we'll be looking for funding from other sources, private and government, to help with this much larger phase of the project. And the funding is largely just to help transport the ambulances to Ukraine. Okay. We have partners that are working very closely with us on the ambulances, refurbishing them so they are mechanically in top condition. Mm-hmm. They're equipped well. All of that, we are fortunate. We have wonderful partners willing to do that with us. Yeah.
OK. So all of the funding is coming from outside of Ukraine. There is no assistance coming from the government here in Kyiv?
Not at present. We haven't requested that. Depending on the partners and where we allocate the ambulances, they have offered to participate in equipping the ambulances. We want to make sure the ambulances are compatible with Ukraine requirements, the voltage here, for example, which is different than in North America. So some of our partners here will be taking on the responsibility to equip the ambulances to meet their needs. OK. Have you also been speaking with representatives from the Ministry of Health? Absolutely. I think it's really important for us to understand where the needs are. In that conversation, we were made aware that in Donetsk Oblast, for example, they've just been authorized to purchase many ambulances to replace those in that oblast. So knowing that now, we can focus our energy elsewhere where there are requirements. Because your help, you would say, is not quite needed in the areas surrounding Donetsk? Well, we understand that they're being supplied with new ambulances, so the priority, I think, would lead us elsewhere. You're able to focus your attention on other areas? We want to complement what's already underway in the country, so that's where we really need to understand from officials, from NGOs, what the circumstances are. We want to complement and ensure that we're not duplicating any effort. OK. John, thank you very much for joining us. That is all we have time for. My pleasure. You have been watching Viewpoint on Ukraine Today, where we have been joined by John Holuk, the coordinator for Ukraine Appeal, an initiative by the Ukrainian-Canadian Congress. Thank you for watching.